Hello everybody, thank you for joining me today, and in today's video we're going to be focusing on exploring how we can score highly in the UKCAT. So a little bit about me. So I've created a YouTube channel called The Medicine Guide, and I've made quite a few videos now on YouTube. So all my videos are focused about applying to medicine and making the application process far more simpler and more streamlined. So I've made a video on how to get into medical school, how to write a successful personal statement for medicine, what types of work experience placements are ideal, how to be successful at a medical school interview, and how to be successful in the pre-clinical years at medical school, so that's years 1 and years 2. So please have a look at some of my other videos. If you enjoy the videos I'm making, please give me a thumbs up, like my YouTube page, subscribe to my channel, and please share this video with your friends. So in today's video we're going to start off with discussing what exactly is the UKCAT. So the UKCAT is an online test which consists of the following key components, and that's something that I'll explain in a little bit more detail as the video develops. Also, I'll be explaining how the UKCAT is used during the application process for medicine, and also how to achieve the best score in the UKCAT, and I'll be signposting you to some of the resources that I found particularly useful, as well as sharing top tips. So firstly, what is the UKCAT? So the UKCAT is an online test that has to be taken by students who are applying for medicine and for dentistry across the UK. So it's a 2-hour online test. It's a multiple choice test, and like I said, it's for all students applying for medical and dental schools. Now, some unis will accept the BMAT, which is slightly different to the UKCAT. It's only really a handful of universities that prefer the BMAT, so it's important that when you attend the University Open Day that you clarify with the university whether they require students to sit the UKCAT or the BMAT, because the two exams are very, very different. So the UKCAT consists of 5 key components. So firstly, there's the verbal reasoning. So students will have 44 questions to complete, and they'll be given a total of 21 minutes. Next, students have the decision-making aspect to complete, so 29 questions in 31 minutes. Then there's quantitative reasoning, which is just the maths component of the test, so that's 36 questions and 24 minutes. Abstract reasoning, so that's all to do with looking at shapes and patterns. That involves 55 questions with 13 minutes to complete them. And finally, there's the situational judgement test, and that focuses more upon ethics and professionalism. So students will have 69 questions to complete and 26 minutes to do so. So although the UKCAT is in total a 2-hour online test, each component of the UKCAT is strictly timed. So if you complete, let's say, abstract reasoning in 10 minutes, so that means you've got 3 minutes left to spare, you can choose to continue on to the next aspect of the test, so situational judgment, and then use those 3 extra minutes to go back to verbal reasoning and just look through all of the answers that you've clicked on just to review your answers. Okay, so firstly we're going to look at the verbal reasoning. So like I said, you've got 44 questions to complete in 21 minutes. So the verbal reasoning is an aspect of the UKCAT where it's focusing upon students' comprehension skills. So it's looking at your comprehension skills, your literacy skills primarily. So there'll be 11 passages of text, each containing 4 questions. You can only select one answer from the list of options that have been offered to you. So it's a multiple choice test, and you can only select one single best answer. So it's important that you read the text very carefully, because you're only inferring and drawing conclusions from the information given to you in that text. So in that text, perhaps there might be something in the text which completely contradicts an element of the topic which you might have some prior knowledge to. However, the entire purpose of the verbal reasoning test is just being able to use that resource, that text extract to infer conclusions from. So it's strongly frowned upon using your own knowledge to answer the questions in the text, because the text is helping to critique your literacy skills. So it's really, really important that you infer conclusions only from the text extract that's been given to you. And some of the questions in the text might be, using the information in the test, is the following statement true, false, or can't tell? So again, you have to refer back to the original text extract to help make that decision. Okay. Next component is the decision making. So you've got 29 questions to complete in 31 minutes. So these questions can be focused upon text, charts, tables, graphs, or diagrams. And you will have an on-screen calculator for this aspect of the test, should you need it. So quantitative reasoning is focusing primarily on your numerical skills, so focusing on your math skills. So 36 questions to complete in 24 minutes. A simple online calculator is provided. So the word problems are at the standard of a student who has completed their GCSE maths, so you shouldn't find any questions focused on complex maths like differentiation and integration. It will be your simple standard GCSE maths, so it will be your standard word problems as such, but perhaps the questions might be phrased in a slightly more confusing and detailed manner, and with time and practice hopefully you'll get better at them. So one of the ways in which they might test you in this section is ask you to review some data and apply the data to answer the following question. They might even ask you to calculate drug calculations based upon a patient's age, weight, and other factors. So abstract reasoning is the next component. So you've got 55 questions to complete in only 13 minutes. So there are 4 different types of possible questions that could come up in this particular section. So you've got 2 sets of shapes labelled set A and set B, and you must decide whether or not this test shape belongs to set A, set B, or neither. You might be given a series of shapes and you need to select the next shape in series. There might be a statement involving a group of shapes and you need to determine which shape will complete the statement. And there might be 2 sets of shapes described as set A and set B, and you must choose out of the 4 possible options which one belongs to set A or set B. So abstract reasoning is focusing primarily on your ability to recognise patterns amongst shapes and being able to understand them. Okay. So situational judgement focuses, like I said to previously, focuses upon ethics and professionalism. So you'll have 22 scenarios with a total of 69 questions, and students will have 26 minutes to complete this. So it's about understanding your ability to reflect on real-world situations and identify key factors. You might be asked about whether or not the behaviour that was performed in that particular abstract was appropriate in dealing with the situation. So, like I mentioned, considering the appropriateness of possible actions and also weighing up the importance of certain considerations, you may even be asked to rate each of the possible responses and rank the list of actions taken from most appropriate to least appropriate. Okay? So next, you'll possibly be wondering about how the UKCAT is used during the application process. So once you've completed your UKCAT, because it's an online exam, you will get your results far more quickly. Usually you'll get your results as soon as you've completed the UKCAT. At least that's the experience I had when I sat my UKCAT. So each component of the UKCAT is scored equally, so you've got a maximum of 900 points that you can score for the verbal reasoning, decision making, quantitative reasoning and abstract reasoning, and the lowest that you can score is 300 in each of the components. So you will get a total score, and you will also get a score based on each aspect of the UKCAT. So you'll be given a total score, and then you'll be given your individual scores for verbal reasoning, decision making, quantitative reasoning and abstract reasoning. Okay? Now your situational judgment score will be slightly different. So the score that you have achieved in your situational judgment test, it will then be applied to Band 1, Band 2, Band 3 and Band 4. Now the thresholds for each of the components of the UKCAT and also the situational judgment test will fluctuate based on the cohort of the applicants that are applying every year. Now, the UKCAT is an important aspect of applying to medical school, and the way in which different medical schools use the UKCAT also varies. So it's important that when you're applying to medical school that you discuss with the admissions team and you read the entry requirements very, very carefully to get a better understanding of how the UKCAT is used at that particular medical school. For instance, certain medical schools might require all students to achieve a total score of X in their UKCAT and also have an average of, let's say, a value Y in each of the 4 components of the UKCAT. However, other medical schools might use the UKCAT in conjunction with the personal statement, with the person's A-level grades and GCSE grades. So it really does vary with each of the medical schools that you apply to, and my advice is that you speak to the admissions team and attend the open days to gain greater clarity. And also be a little bit savvy when you're making your medical school applications, because some medical schools will prefer a more competitive score in terms of the UKCAT. Other medical schools will appreciate that this is a very abstract test and may not necessarily give as much weighting to the UKCAT as they might do to the amount of work experience you've completed or your achieved GCSE grades and your achieved A-level grades. So the best thing to do is to speak to the admissions team, attend university open days and look carefully at the entry requirements for all the universities that you're interested in, and be savvy and try to apply to a university that you think will look upon your UKCAT score and your medical school application more favourably. Okay? So in terms of preparing for the UKCAT, there are lots of resources out there. Some students believe that the UKCAT is something that you can't revise for, and whilst I do appreciate that is to a certain extent true, however, you can prepare for the UKCAT, and it is a very important part of your medical school application, because unless your medical school application is looked favourably by the university, it's unlikely that you'll get an interview. And to this day, I've never heard of anyone get an offer from medical school without getting an invitation for interview. So it's really, really important that you try to do the best that you can in the UKCAT. Now, on the UKCAT's official website, they do have some free online resources available for students. So on the far left, you can see an example of practice tests, so test A, B, C and D. so you can practice this prior to taking UKCAT, and that's something that I would strongly recommend. In the middle you can see that there's a series of question banks available for each aspect of the UKCAT, and again this is on their official website. And finally you can see on the far right that the UKCAT has an official app, and this is something that wasn't around when I applied to medical school, and it's a free app, and it will try to mimic the examples of some tests and questions that could possibly come up on the UKCAT exam day. So I would strongly recommend that you initially use the resources on the UKCAT website as part of your preparation for the UKCAT. So other resources that you can use includes UKCAT books. So I've used all three of these books and I thought they were really helpful in terms of preparing me for the UKCAT. So initially on the far left you've got the 1250 practice UKCAT questions. Now I would say this is the Bible for all UKCAT preparation. This is perhaps the #1 book that I think all medical students use for preparing for the UKCAT. So I would strongly recommend that you get access to that book. In the middle there is Pass the UKCAT and BMAT edition. I appreciate it's a little bit old, but I do think it's good for students who are interested in UKCAT and also the BMAT. And then finally, this is a book that I found really helpful, How to Master the UKCAT, and the author is Mike Bryan, Dr. Chris Timon, Jim Claydon, and Dr. Christopher C. So please have a read of these books and try your best. Other resources involves online question banks. So Medify has a free online question bank, and I didn't realise this until quite recently. Medify also offers an online teaching course for the UKCAT, and if that's something that you're interested in, and if that's something that you feel that would benefit you, then please do so. And similarly, Kaplan also offers online UKCAT courses. It can be a little bit pricey, but again you need to weigh up whether or not you think it's beneficial to you, and perhaps discuss with friends and family about whether or not you'd be interested in attending these courses. Now, I've got a picture of Tomorrow's Doctors and Good Medical Practice, and I do apologise for using this in another video yet again, but I just wanted to stress to you the importance of these two texts. So these two texts are very important for the Situational Judgement test, which is a key component of the UKCAT. So hopefully after reading these two texts it will give you an idea of some of the ethos surrounding professional values and ethical scenarios and attributes which are expected of doctors. So you can read these two texts online as a free PDF, so you can search for this on Google, or you can look directly at the GMC's website, and these two texts will be available as an online PDF which you can download and read at your leisure. But these two are very important, not only for the Situational Judgement test, but also in terms of writing about your work experience in your personal statement, and that's something that I've mentioned in previous videos as well. Okay, so this is the references that I've used today, and this is a message that I want to leave you with. So sometimes we're tested not to show our weakness, but to discover our strength. So I do appreciate that UKCAT is a very difficult test. It isn't something that will come naturally to many people. I know that it didn't come naturally to me, despite what other people say about the fact that you can't revise for the UKCAT. You can definitely prepare yourself for the UKCAT and put yourself in the best possible position to score as highly as you can, and to make your application that much more competitive, so you can hopefully get a place at interview and fingers crossed secure a place at medical school. So thank you for watching my video today. If you've enjoyed my video, please hit the like button, subscribe to my channel and comment in the comment section below, and please share with friends or anyone else that's interested in medicine. So thank you for watching my video and best of luck with your application.